Hello friends, I am Dr. Samina and welcome to our channel Homeopathy World. In today's video, we are going to discuss about the newly released Homeopathic Repertory app. So let me tell you something about the Homeopathic Mini-repertory app. It was specially designed to prescribe in COVID-19 cases. So this repertory is a time-saving repertory which helps us to prescribe in cases which are COVID-19 positive cases. So here I am going to explain all about this Homeopathic Mini-repertory app. There was a Google Meet of all the important dignitaries in the homeopathic field regarding the Homeopathic Mini-repertory app. During this meet, that is, the national webinar held by Northeastern Institute of Ayurveda and Homeopathy on 14th August 2020, an important milestone in the homeopathic field was released, that is, the Homeopathic Mini-repertory app. This app aids the selection of remedies in COVID-19 pandemic and was presented by Dr. R.K. Manchanda sir. It was discussed that the Homeopathic Mini-repertory app is designed to facilitate the choice between the remedies like Arsenicum album, Bryonia, Gelsemium, phosphorus and pulsatilla. Now as we know that COVID-19 is a pandemic, and what homeopathy says about epidemics is that there is a particular remedy that acts as genus epidemicus. This particular remedy is the most suitable simillimum in almost all the cases of the epidemic. But as here, with COVID-19, we are facing a worldwide pandemic in which we come across cases which show a range or variety of symptoms. Hence here, we are unable to get a single remedy or group of remedies as genus, as each patient is having his own set of symptoms. So there are multiple remedies that have been suggested as a choice of remedy in COVID-19 patients. As in the practice, we have seen some of the patients represent Arsenicum, while others represent Bryonia, while some other patients represent some other remedy. And similarly, it is happening all over the world. So through this Homeopathic Mini-repertory app, what we are going to do is, we are going to choose from the 5 more important remedies that have been the most frequently indicated remedies in the COVID-19 patients. So basically, whenever we take the COVID-19 cases, we come down to a group of remedies which are most commonly indicated simillimum, out of which are these remedies. However, there are many indications and there are many remedies that are indicated in COVID-19 patients. Like there was Nux vomica, lachesis, nausea, aconite, belladonna, etc. There were multiple remedies that were given in COVID-19 cases. So not all COVID-19 patients show characteristic symptoms that can differentiate between these 5 most indicated remedies. In such cases, a combination of 3 or more common symptoms can produce the same indication as one characteristic symptom. Based on this whole concept, Tom Medley, Galen Ives, and Lex Rutten have created an app which performs these calculations on the basis of actual clinical data and provides us with the best possible simillimum. This app is designed with 22 symptoms to select from and attain the remedy for that particular case. This application can be assessed by homeopaths for prescribing COVID-19 cases with best possible simillimum using a web portal. However, only a well-experienced homeopath should handle the cases for better outcome. Database offers yet more information such as symptoms which can be used for confirmation following recommendation of the app, such as Arsenicum for sleeplessness, desire for warm drinks and fear of death, Bryonia for thirst in large quantities, cough aggravated while talking, cough aggravated by deep inspirations, desire for rest and motion aggravation, Gelsemium for involuntary urination from cough, heavy eyelids, cannot keep eyes open, chilly back, and headache ameliorated by profuse urination. Phosphorus for gasping of air, chest discomfort, and fear of being alone. And pulsatilla for loss of appetite, wants to be held, and bitter taste in mouth. Of course, homeopathic practitioners have their own experience of confirming a specific remedy, but the symptoms mentioned are a combined knowledge and experience of many other doctors. Liga Medicorum Homeopathica Internationalis, that is LMHI, prepared a database of the COVID-19 cases treated with homeopathy all over the world in association with members of 76 countries including India. This data has been collected and analyzed by American Institute of Homeopathy using the likelihood ratio of the following symptoms: fatigue, dry cough, productive cough, dyspnea, fever, headache, chill, perspiration, diarrhea, throat pain, muscle or bone pain, anxiety or fever, loss of smell or loss of taste, thirst, thirstless, nausea, backache, abdominal pain, chest pain aggravated by cough, amelioration in open air, restlessness, and desire for cold drinks. The web portal that is required to access this homeopathic mini repertory app is given in the description below. So you can just click on the web page and the web page will appear. And what I'm going to do now is I'm going to log into the web page through my Chrome browser in my cell phone, and what you will see next is the screen recording of my phone. I hope mostly all the homeopaths are going to use this web portal on their mobile phones, and so I'm going to show it on my mobile phone right now. Okay, so let's say there is a case of 69-year-old male patient with COVID antibodies positive, and the complaints he is suffering from is fatigue, dry cough, dyspnea, fever, chills, chest pain aggravated with cough, muscle pain, and weakness. So according to our case, so next what you're going to see is the recording of my phone. So I am into my Chrome browser. Okay, so I'm just going to type the web address, that is https://hpra.co.uk. So when I enter this, okay, so I got this welcome page. It says, welcome to the homeopathic mini repertory app. This app has been developed using the experience of medical homeopaths worldwide who have responded to the request for help by COVID-19 patients. As is often the case in epidemics, a small number of remedies are perceived to be helpful by a large proportion of patients. This app is designed to facilitate the choice between the 5 which have been found to be most common, that is Arsenicum album, Bryonia alba, Gelsemium, phosphorus, and pulsatilla. Further medicines may be added as and when more data is available. Background information is given a separate document of the Liga Medicorum Homeopathica Internationalis, LMHI. So I'm just going to click on next. This app is provided for information only and no specific outcome is warranted. So this app is just for an explanation purpose. Nobody should assume that using this app, whatever remedy you get will definitely cure COVID-19 patients, should not be assumed. Homeopathic medicines are safe provided their use do not delay proper medical care. So when you are using these type of homeopathic medicines using this repertory, It should be remembered that this cannot be given in severe cases or the cases which require immediate medical attention. Homeopathy should only be used as an addition to usual medical care. So, in COVID-19 cases, homeopathy is not used as a sole treatment. That is what they are saying. Every patient should consult a doctor when feeling ill or if health deteriorates. It is still unclear from the current data whether homeopathy as an adjunctive treatment will be helpful in any way to the patient with COVID-19 complaints. Clicking next and using this app confirms that you have read and understood this paragraph. Okay, so I'm just going to click on next. I'm going to the third slide, that is enter the symptoms which the patient currently shows, selected from the list presented. Research has measured the relationship between each symptom and the response to each remedy, specifically in COVID-19 patients. This information is used to calculate the best match to the current presenting symptoms. I'm going to click on next again. So here, what are the symptoms? Can you see what are the symptoms? So there are 22 symptoms given here. So there's a question mark against each symptom. Can you see? So I'm just going to roughly check what is it. My first symptom here is fatigue. So I'll just see the question mark. The patient looks and feels tired or exhausted. So basically the question mark will tell you in detail about the symptom. So if you don't know what is productive cough, you can just click on the question mark, and the patient produces mucus or sputum while coughing. So it will tell you the meaning of the symptom. So basically here they are, the 22 symptoms which I have earlier mentioned, and when you finish it, it's written that click when all symptoms are entered. So you have to click when all the symptoms are entered. Okay, so to understand this app better, or to see if or it can be utilized in a proper manner, what I'm going to do is I'm going to share a case with you, and we are going to put the symptoms of that case in this repertory and see which remedy comes out. Okay, so let's say there is a case of 69-year-old male patient with COVID antibody positive. Okay, so he is suffering from fatigue, first complaint, dry cough, dyspnea, fever, chill, chest pain, aggravated with cough, muscle pain and weakness. Insert. Now according to our case, I am going to insert these particular symptoms in this repertory. So what we are going to do is we are going to select the symptoms which are present in our case. So there is fatigue, there is dry cough in our patient, there is dyspnea, there is fever and there is chill. We don't know about these things, but there is muscle pain, there is no anxiety, no loss of smell or taste, the patient is neither thirsty nor thirstless, no nausea, no back pain, no abdominal pain, cough aggravates chest pain, yes, no restlessness, no, not better in open air, and no desire for cold drinks. Now I am going to click when all symptoms are entered. So the symptoms are a strong indication for Gelsemium, sempervirens, or a slight indication for phosphorus, or a slight indication for Bryonia alba. So basically it is giving us strongly, the strong indications are of Gelsemium. So it is saying that primarily you should give Gelsemium if the patient is not better, or there is a slight indication of phosphorus and a slight indication of Bryonia. So that was all, and if you are not happy with the results, you can always start again, or even if you don't want to prescribe out of these 5 remedies, you can always choose your own remedy to prescribe. So there is nothing wrong with that. There are many remedies which are indicated, as I have already mentioned in my
video that there are many other remedies which are highly indicated in COVID-19 cases, but these 5 are the most indicated. So normally a patient with COVID-19 shows fatigue, okay, productive cough, dyspnea, headache, fever, chills, diarrhea, sore throat, okay, anxiety. I don't know much about anxiety, but people are coming with backaches. Yes, people are coming with cough, worsens chest pain. People are representing these complaints. People are restless, okay. And if I click the strong indication of phosphorus or a moderate indication for Gelsemium or a slight indication for Bryonia. So it is giving me 3 remedies right now with strong indication of phosphorus, moderate indication of Gelsemium and slight indication of Bryonia. So it tells me if a patient comes with these complaints, I should first go with phosphorus, and then if the patient is not better, the complaints are not better, I can think of Gelsemium or I can think of Bryonia.
Now let us see the review of pros and cons of this particular app. Let's start with the pros. The benefits of using this app is it is faster and time saving app. It has only 22 symptoms, which makes it easier to approach the simillimum in minutes. It is a user friendly portal that everybody can use it, and it is a smaller app which makes it easier to load. It won't take much of your mobile data, and it becomes easier to load in emergency situations, and also helps the physician in getting the clearer perspective in treatment of COVID-19 cases. So in case if somebody is hesitant in treating COVID-19 cases, or they don't know from where to start, they can use this app and start treating or giving homeopathic medicines in COVID-19 patients. Now let's talk about the cons. That is why this app is a little bit difficult to be used in regular practice, since there is no much scope of individualization in this particular app. So there are only 5 remedies and there is no individualization. So suppose if a patient seems to be like lachesis or is seeming to be having a similarity with belladonna, there is no such rubrics which help you individualize this particular case. Now the most important drawback of this app that I saw was the outcome. Since I used 2 cases to get the outcome, and in each of the case I got 3 remedies. One was strongly indicated, one was moderately indicated, and the other was mildly or indicated. But see, when you are doing these type of repertorizations, you need to have a single outcome so that the physician is clear on his idea of prescription or has a clearer perspective in treatment. But here when the app gives you 3 outcomes, the physician eventually has to decide that which remedy is most indicated from these 3 remedies. So now your duty becomes, instead of finding out which is the simillimum from the 5 remedies, it gives you 3 remedies. So basically it's cutting down from 5 to 3 remedies. So when you know the 5 remedies, you can eventually come out to your own simillimum. Like if you can find out the 1 remedy from 3 remedies, you can also find out 1 remedy from the 5 remedies. So that is what I thought. It should have given you a more clearer picture or more clearer outcome by giving you 1 or maximum 2 remedies out of the 5 remedies. Now also one more drawback of this particular app is that it has the data of only 5 remedies. So there are and there may be other remedies that might be indicated but will not be prescribed in COVID-19 cases because it's not indicated in this particular app. So that was all about the pros and cons. I hope you like the video. I hope you use this particular app and it becomes more used by homeopaths all around the world, so that we get to know a clearer picture of whether it is useful or whether it's having good effects, the drawbacks, and everything regarding this app can be more clearer if many homeopaths use it and give their own views about the app by using it. Regarding the data has been not updated and is still in working process. So this app is still in a working process, and it may be enhanced. It may be they may enhance it and make it more better, more usable, and more approachable. So I hope you like the video, and I hope you use this app. And if you have come across any COVID-19 cases, or you have seen or read about COVID-19 cases, please do solve those particular cases using this repertory. So the outcome of your own repertorization and the repertorization of this mini repertory app is same, or it comes to be different. Please do comment on our video and tell me if you like the video, and do like, share and subscribe to our channel, and click on the bell icon to get the notification on our latest updates. Thank you so much.